Every day, millions of older adults are taking medications that could be quietly harming their hearts. What if I told you that some of these drugs are not experimental treatments or illegal substances, but rather common prescriptions that your doctor may have recommended? This is a shocking reality that cardiac surgeons are witnessing in their operating rooms. They are seeing alarming patterns. Hearts that should be fairly healthy for someone's age are exhibiting signs of stress and damage. Inflammation markers are unusually high. Heart muscles are weaker, and dangerous rhythm irregularities emerge seemingly out of nowhere. And here's the revealing part. When doctors review patient histories, they repeatedly find the same medications at the center of this escalating crisis. Studies and reviews published in reputable medical journals, including research affiliated with institutions like the Cleveland Clinic, highlight that some widely prescribed medications can carry cardiovascular risks for older adults, especially when used long-term or in combination with other drugs. Many patients may not be fully aware of these potential risks. The aim of this video is not to scare you or suggest stopping your medications. Instead, it's about raising awareness, helping you have informed conversations with your doctor, and supporting choices that promote overall heart health. Let's dive into some of the medications that are most frequently linked to heart issues. First up are proton pump inhibitors, commonly used for acid reflux or heartburn, like Nexium. While they're effective in the short term, long-term use in older adults has been associated with changes in blood vessel function and reduced arterial flexibility. This means that in the long run, these commonly taken medications can add undue stress on your cardiovascular system. Simple lifestyle adjustments, like eating smaller meals, avoiding late-night snacks, and changing your sleeping position, can help reduce reliance on these drugs. Next up, let's talk about a class of antibiotics known as fluoroquinolones. Medications such as ciprofloxacin, levofloxacin, and moxifloxacin have been linked to heart rhythm changes and structural risks, like aneurysms, in older adults. Healthcare professionals now advise a careful evaluation before prescribing these medications unless absolutely necessary, and exploring safer alternatives should be a priority. Another group requiring caution are nonsteroidal anti-inflammatory drugs, or NSAIDs. While medications like ibuprofen and naproxen might be safe for occasional use in younger adults, chronic use in older adults can elevate blood pressure, increase the risk of clotting, and stress the heart over time. Instead of turning to these pain relievers, consider non-drug approaches like physical therapy, gentle exercise, and topical treatments to manage pain. Then we have certain diabetes medications that can carry hidden cardiovascular risks. Older drugs that stimulate insulin release excessively might increase heart stress and create vulnerabilities in heart rhythms. While some newer medications offer heart benefits, older adults need to understand how their medications interact with cardiovascular health and discuss alternatives with healthcare providers. Sleep medications, including Z-drugs and benzodiazepines, can also pose significant risk. They may increase the likelihood of falls, exacerbate sleep apnea, and place additional strain on the heart. By adopting safer sleep strategies, like maintaining a good sleep environment and consistent sleep schedule, you can improve your rest without increasing cardiovascular risks. Antipsychotic medications, often prescribed for behavioral symptoms in older adults, have come under scrutiny for their association with heart complications and sudden cardiac events, particularly when used long-term or prescribed off-label. Seeking behavioral interventions or environmental modifications can be safer methods when these medications are deemed necessary. Creating a healthier, less stressful environment, engaging in activities you enjoy to relieve tension, and taking long walks to step away from daily worries. All of these help recharge your energy and give you the strength to face life with a renewed mindset. Finally, let's not overlook opioid pain medications, which represent one of the most severe risks for aging hearts. Drugs like oxycodone, hydrocodone, and morphine can interfere with breathing, reduce oxygen levels, alter heart rate, and potentially cause long-term structural changes to the heart. Chronic use of these medications in older adults has been shown to correlate with a higher risk of heart-related mortality. Now, while all this information may seem daunting, remember that the objective here is awareness, not alarm. Understanding these risks enables you to engage in meaningful discussions with your healthcare team, consider safer alternatives when necessary, and integrate daily habits that support heart health. So, what can older adults do to safeguard their hearts while still taking necessary medications? First, stay informed. Keep a detailed list of all your medications and understand the purpose of each one. Your health is your responsibility, so don't hesitate to voice your concerns with your doctor. Secondly, focus on lifestyle choices that bolster heart health. Engaging in moderate physical activities, eating a balanced diet, maintaining a healthy weight, and managing stress are powerful strategies that can help your heart withstand daily pressures. Third, pay close attention to your heart signals. Notice changes in energy, breathing patterns, or unusual heartbeats, and report these developments promptly. Early detection can often be the key to preventing serious complications. Fourth, timing and consistency are crucial. Taking medications according to your doctor's instructions minimizes the chances of adding unnecessary stress on your heart. Irregular intake or mixing various medications without professional advice can escalate risks. Lastly, avoid self-experimentation with your medications. Never start, stop, or combine medicines without guidance. The focus should be on informed dialogue with your healthcare provider, not self-prescription. Your heart is resilient, but it is also sensitive. Even routine medications can accumulate over time and exert stress, particularly in older adults. Being aware is the first step toward protection. You now hold the key to observing your heart health more closely, asking essential questions, and collaborating proactively with your medical team. Finally, remember that small daily habits can lead to significant changes. Staying active, adhering to a heart-healthy diet, managing blood pressure, avoiding smoking, and controlling stress are all strategies that bolster heart health without the risks posed by excessive medication. Take a moment today to look through your medicines. Ask yourself, do you know the reason you take each one? Do you understand how each medication affects your heart? Are there safer alternatives or lifestyle strategies you can talk about with your healthcare provider? Raising awareness can help decrease the hidden risks associated with everyday medications, ultimately allowing you to protect your most vital organ, your heart. Don't miss out on more videos like this. Subscribe to our channel to stay updated and discover useful and interesting content every week.